Whenever we go and meet our dentist, we expect them to talk about our teeth or our oral health in general. But the studies have proven that there is a huge correlation between the quality of our general health and the quality of our oral health. And there are lots of signs and symptoms of major health problem can be visible in the mouth as well. My name is Swati Maan. I am a dentist, and today we're going to talk about the correlation between the dental health and the general health. Whenever we have bleeding gums or during our dental examination and during checking our gums, the dentist says, well, look, you have pockets around your teeth, what we call as a periodontal problem or a severe form of gum problem called as periodontitis. The thing as a solution that comes to our mind is, well, we have to fix our gum problem. But on many occasions, there is much more to it. For example, the things which are building within the body in the form of disease can be reflecting on the surface of the gums in the form of periodontitis or vice versa, which means the severe form of periodontitis can lead to the escalation or aggravation of these things or diseases which are building within the body. To be clear, I'm not saying that periodontal health or the periodontal problem is the cause of the health problems, but it can escalate or speed up the speed with which the health problems are building up. The study started back in 1900 where the removal of infected teeth or infected tooth led to the better quality of health in a patient, and they call it as a focal infection and proved that there is some relation between the general health and symptoms in the mouth in the form of infection. Coming forward now, there has been studies which have proved that there is a direct link and correlation between periodontitis, which is a severe form of gum problem, with heart diseases, type 2 diabetes, pregnancy-related problems, and also to various diseases that includes respiratory diseases, kidney diseases, cognitive impairment, metabolic disorders, obesity, and also there's an association between periodontal health and cancer. So let's try and understand what is the mechanism of action and how does this really happen, and how the bacteria from the mouth or how the bacteria from the periodontitis can affect the general health. Well, there are two mechanisms that work here. Number one is a direct entry, which means when we have periodontitis, there is the pocket around the teeth, which can colonize a lot of bad bacteria, and the epithelial lining or the outer skin of these pockets is breached or ulcerated or lacerated, which can give direct entry to these bad bacteria into the bloodstream and leading to various other problems. Number two is the indirect entry, which is associated with inflammation, because periodontitis is an inflammatory disease, and the inflammatory byproducts from periodontitis can go into the bloodstream and lead to various problems or aggravate various problems which are forming within the body. The CRP test, also called as a C-reactive protein test, when it's done in the patients with periodontitis or a gum disease, we always found the level of CRP much more in the patients who do not have periodontal problems. And CRP or a C-reactive protein is directly related to the inflammation in the body, which can lead to various serious other problems. Also, if we talk about the microbiology here or the correlation of the bacteria, there is a link between dental health and the general health. First bacteria is called as a P. gingivalis, also called as a Porphyromonas gingivalis. This bacteria is found in the people with periodontitis and is also found in the people with heart problems or coronary heart diseases. The P. gingivalis is responsible for thickening the arteries by helping in the deposition of the fatty material, which can lead to the blockage of the arteries and leading to heart problems. Another bacteria here is Fusobacterium nucleatum. I know these are scientific names, but this bacteria is also found in the people with periodontitis as well as in the people with cancer. The recent studies have shown that the female who have severe periodontitis or who have a long-lasting periodontitis, they are 2 to 3 times more vulnerable to have breast cancer, which is quite a high number. Also, we know there's a direct link between the periodontitis and also leading to type 2 diabetes because it changes the glycemic control of the body because of the inflammation. Because of this inflammation, again, the pregnant female can have preterm birth and they can have the babies with lower birth weight, or it can also lead to preeclampsia. So we can see that how our body is so magically related. So my reason for making this video is not to scare you, but just to make you aware that if you have a long-lasting gum problem, if your dentist is telling you about pockets or periodontitis, it's always good to have a follow-up and make sure you have your full body checkup as well, to make sure that we know that if there's anything developing, we can always catch that thing at an early stage, because the things can be serious. So I hope you like my video. If you like the video, please subscribe to my channel, and I would thank you all again for watching, and I look forward to see you all in my next video. Thanks.